My name is Lindsay. I am on the Optimize Your Life team, and we are happy to present the Sleep-posium today. I want to introduce you to Sina from SWAN Medical, and he is going to take it from here, introduce our physicians, and get us going.
Thank you, Lindsay, and thank you to the entire wellness team here at Google. I want to say welcome also to Googlers joining us via GVC. We've got people from Ann Arbor, Cambridge, Chicago, Kirkland, LA, New York, San Francisco, so welcome to you all. Get closer, okay. I just wanted to say, again, that I think it's wonderful that we're doing this event. In 1999, Google was an 8-person company. And today, obviously, it's one of the largest and most well-known companies in the world. I think actually, we're seeing a similar thing going on with sleep. It didn't really used to be part of the conversation in a corporate context, but really now it's starting to, get a little bit more attention. It's a wonderful thing to see Google, in particular, making sleep a priority. I think really it's a testament to the leadership in Google's wellness team. That being said, let's go ahead and meet our guests. Immediately next to me here is Dr. Manoj Waikar. He is a board-certified psychiatrist with private practice here in Silicon Valley. Next to him is Dr. Sue Kim, Google's very own Dr. Kim, who's double-boarded in internal medicine and integrative medicine. She also completed her fellowship at Andrew Weil's program at University of Arizona. Next to her, Dr. Jerry Hester. He is an otolaryngologist who is focused on the diagnosis and treatment of snoring and sleep apnea. And next to him on the end there, we've got Dr. Steve Brooks, who's board-certified sleep specialist and also former attending physician and clinical associate professor at the Stanford Sleep Clinic. We're also fortunate to have Congressman Michael Honda with us today, and he's actually going to give the closing remarks. So welcome to you. And before we get started, I thought it'd be nice to have each of the doctors actually go through and give sort of a quick personal introduction, just kind of background and your interest in sleep and that sort of thing. So Dr. Waikar, you want to start us off?
Hear me? Yeah, okay, it's a pleasure to be here. I'm a psychiatrist, which normally is like saying I'm the boogeyman, but there is a tremendous overlap between issues related to emotional and behavioral health and sleep. I would say virtually 100% of my patients have sleep disturbance of some kind or another, and the converse is actually even more interesting, which is a majority of people who think that they only have a sleep problem end up having some emotional or behavioral connection to that. And so a lot of my practice has ended up moving in this direction of helping people optimize sleep, and everything else follows.
Hello. Okay. So I have a specialty in integrative medicine. I also practice internal medicine. I'm also a medical acupuncturist, and I definitely have an interest in sleep. I think it's pervasive, and it really affects quality of life, and I'm really interested in lifestyle and nutrition and how that affects sleep, as well as many other issues.
I'm an otolaryngologist, which is ear, nose, and throat doc. The overlap here is that one specific disorder, sleep apnea, which can occur in pediatric and adult age groups, is commonly not diagnosed. Not only can it lead to problems with functioning and maximizing how we all complete our day, but it actually has pretty significant health concerns associated with it, such as heart disease and stroke. And so been working in the field for about 20 years in the diagnosis and treatment of that area.
Can you hear me? I'm delighted to be here today. I think this is going to be fun, and hopefully we'll be able to tell you something you don't already know. I'm a neurologist by background. Came to the sleep field relatively late in my career, but it was attractive, aside from the fact that I think it's just very inherently interesting. Most sleep disorders are treatable, maybe not curable, but treatable. So we can help pretty much everybody that comes into the clinic. So it's been very gratifying that way.
Thank you all. And I think we have such a wonderful panel of doctors here. I think we're going to really we're going to be in for a treat here with such a great kind of cross-section of disciplines. Before we jump right into the questions, I thought it might be nice to sort of set the stage and look at what they call sleep architecture. And Dr. Brooks, I thought maybe you could help us kind of tell us what we're looking at on the screen here.
Sure. This is a graphical depiction of what's going on with sleep across the timeline of the night. You keep in mind that sleep is a very active process. It's not just a down state. A lot of things are going on in the brain and the body. Neurotransmitter systems are coming online, going offline, interacting with each other. So stuff is happening across the night. And by convention, we have broken sleep down into what we call stages, which are periods of sleep distinguishable by form and also probably by function. We tend to go in and out of these stages in cycles through the night, which roughly last about 90 minutes at a time. Just very briefly, what we do when we look at an overnight sleep study is that we examine every 30-second period of time, and based on the brainwave pattern, we assign it to one of these categories, either wakefulness, stage 1, 2, or 3 of non-rapid eye movement sleep, or rapid eye movement sleep, which we call REM. It's a different animal than the rest of sleep. We start out awake and then hopefully go into stage 1 after a few minutes. This is the ideal situation, of course. Things never look quite this orderly in the real world. We enter stage 1, which is really just a transitional state. You might call it light sleep. There may be some imagery. You may be able to remember that if somebody wakes you up. It's usually easy to awaken the sleeper from stage 1. And then we go into stage 2, which looks a little bit different in terms of the brainwave pattern. It's sort of the plain vanilla sleep. That's where most of us spend most of the night. Then shortly after that, we enter what's called slow wave sleep or deep sleep, stages 3. Well, we call it stage 3 now. It used to be 3 and 4. And again, this is based on the amount of slow wave activity that we see on the brainwave pattern. What we see on the EEG is just a bunch of wavy lines, and we look at the predominant waveforms in terms of frequency and amplitude. Stage 3 is interesting. It's hard to waken somebody from stage 3. If you do, they're going to be very, very groggy. This is where a lot of weird stuff happens, like sleepwalking and the various iterations of that. It's also probably the most restorative phase of sleep. A lot of hormonal activity is going on, including growth hormone, which makes this particularly important for young children who are still growing. We tend to lose the amount of this as we get older. We probably spend maybe 5% in stage 1 in adulthood, 50% in stage 2, and the rest is maybe 25% in REM, and the rest is slow wave sleep. You can also see a little bit of a pattern on this slide. Most of the slow wave sleep tends to be aggregated toward the beginning of the sleep onset and then gradually tapers off toward the end. The opposite is true of the REM pattern. The REM periods tend to be longer. REM is, as I said, a different animal. It's a very, very active brain state. The brainwave pattern actually looks very similar to what we see during wakefulness. We also have to look at muscle tone and eye movements in order to designate this sleep stage. This is where most dreaming occurs, not all of it, but most of it. It's more easily, you're more easily awakened or aroused from REM than you would be, say, the stage 3 sleep. And we still don't know exactly why we have REM. It probably has something to do with neurological processing of information that comes in during wakefulness, and also organization of memory, and maybe even deleting some of the synaptic connections that subserve memories that we no longer need. So it's sort of cleaning up the hard drive a little bit. I think that's about all. You probably know as much as I do about sleep stages now, so that's all I'm going to say.
Thank you, Dr. Brooks. So as you guys can see, there's a lot of stuff happening during sleep. Sometimes there's a tendency for people to think, well, you put your head on the pillow and you wake up and that's really it. But as we just heard, there's a whole lot of stuff going on, from hormonal regulation and so on and so forth. So now we're going to go ahead and jump into questions now that we kind of have the stage set in terms of the kind of what's going on under the hood. So we'd like to open it up to questions. Maybe we can kind of alternate one from the audience and one from the dory. So I'm going to ask Jay maybe to help jump us on the dory here. But in the meantime, let's go ahead and open up the questions. Go ahead. Yes, please.
Appropriate from an Android. One of the things of sleep hygiene is to not watch TV less than 8 hours. But I was going to ask you how to screen when I'm reading from scientific.
So great question. Let me repeat it here for our audience across the world. The question was about tablets and kind of looking at, reading books and that sort of thing, and how that might interfere with sleep. So maybe Dr. Brooks, you want to start us off with that?
Sure. The main issue with the exposure to screens and such is the luminosity of the light, and that has an impact on the melatonin cycle. So if you get a lot of exposure, particularly to bright light, near bedtime, it's going to tend to suppress melatonin and make it harder for the brain to enter the sleep state. You can minimize that by turning down the luminosity on your screen, and it seems that in terms of the light exposure, the blue area of the spectrum seems to be where most of the money is. So I've even asked people to wear tinted lenses that will filter the blue light, like a red sunglasses, or you could even put a piece of cellophane over the screen. That would be helpful also. But the other element of that is that depending on what you're looking at on your screen, it might be very activating, and that's going to make it harder for you to go to sleep.
And Dr. Waikar, I was going to just ask, is there any kind of psychiatric sort of implication from this?
Well, actually, I was going to say this is a great opportunity for an app, right? Imagine if you could create an app that changes the luminosity as well as the color of whatever you're looking at on your screen. Then you could call it a sleep safe app of some sort. But I think the issue is certainly what Dr. Brooks said is absolutely right. But beyond that, it's just the tip of the iceberg as to why, is it just a normal thing that you're up and this is how you like to wind down? Or is there something wrong and you can't sleep because there's too much on your mind, the voices in your head, whatnot? So, it always helps to know, just the basics. Well, what are you doing? Why are you up so late reading? Is it actually you're online on your tablet gambling, playing poker till 4 a.m. like some of my patients, or is it just routine stuff? So there's always a question. Anytime someone asks about sleep for themselves, the sort of investigator in us has to sort of wonder, well, what else is going on? I'll give you an example. About 80% of people currently age 55 and older, they could, on a structured interview, show all the signs of major depression, which is a serious life-threatening condition, and yet the only complaint they'll make is, I can't sleep. And, we could send them for a $2,000 sleep study only to find that they don't have apnea and whatnot, but in the meantime, they could commit suicide. Now, I'm being dramatic, but the point is sleep problems present as a tip of the iceberg for a whole host of underlying issues.
Dr. Kim, please, yes.
So, on a sort of less serious note, I think it's also important in terms of what you're associating your bed with. So, this is sort of a common theme that arises, but sleep association. So if you're spending the majority of your evening reading in bed or, watching TV or doing other things in bed or, lying awake, then your bed starts to become a place where you don't sleep. And so then when you see your bed or when you're in your bedroom, you think of everything but sleep, and it sort of becomes a struggle and I think a war. So I think sort of resetting those associations is helpful. And this is kind of a good concept to also implement with new parents and their children and teaching them about sleep associations.
Thank you, Dr. Kim. Actually, you mentioned new parents. We're actually going to be having a workshop here for Googlers on new parents coming up. You can check out go/OYL for that. Now let's take a question real quick from the Dory. We've got a Googler writing in saying, I always feel sluggish when I wake up. Do you have tips for maximizing the quality of my sleep and feeling awake more quickly? So that kind of dovetails nicely on what you just said. As a quick side note, Dr. Kim, I actually took some of your advice, and I had some chamomile last night, and I had some protein this morning, and it seems to work just fine. Thank you. So maybe you can start us off with kind of some tips, and then maybe some of the other doctors can jump in as well.
Little sidetrack. So the topic.
But feeling sluggish when they wake up, and then for maximizing quality of their sleep.
So there's so many issues, and this is why it's important to go to your physician and have a discussion, because it could be anything from you're simply not sleeping long enough, and being, for example, aroused during deep sleep. So if you're being awoken by an alarm clock and you're maybe not ready to get up, that could be one issue. The other aspect is did you drink, or what is your intake of other types of substances? It's such a host of issues. But, I guess the first thing to look at would be, are you just spending enough hours in bed? And, and the other question, I guess, is being awoken by an alarm clock, as opposed to allowing yourself to sort of get up when you can, or that kind of thing.
Dr. Hester.
The only thing that I would touch base along the same line is you may get, as we discuss this, to say how complicated this field truly is. And on one hand, whereas a lot of things are attributed to psychiatric issues, the converse can be true. So I think the bottom line should be is that we should start to be expecting out of our sleep, like we do with many other things in our health, that we should not tolerate poor sleep and fatigue as part of our daily lives. I think all of us see many, many patients who come in who self-diagnose and say, the reason why I'm fatigued first thing in the morning is this or that happens. Don't get me wrong, any of us, if you go to bed at 2 and you get up at 5, you're going to be tired when you get up. The question really is if you allow yourself to spend enough hours in bed and you're still not feeling well, many, many, many times there is a diagnosable reason for that. And I think that's different than 5 or 10 years ago in the medical community. So I would really encourage people who have a difficult time with that, if it's something that's constant and chronic, not to write it off, but try to get to the root problem that's there.
Dr. Waikar, go ahead, please.
So, if you recall the slide that Dr. Brooks put up, one at least good nugget from that related to the question is Dr. Brooks was talking about the slow wave or deep sleep, that stage of sleep being the one that is traditionally thought of as being restorative. Now, it's very interesting because just aging alone decreases our ability to get slow wave sleep. But if on top of that, I tell you, for example, that even the mildest form of anxiety or depression directly decreases slow wave sleep because it often gets replaced by an inordinate amount of REM sleep, you can end up sleeping 8 hours, for example, and still not feeling restored in the morning. So, Dr. Hester is absolutely right. I mean, it is not something anybody should tolerate because there could be a host of reasons, and each of us, from our pie in the medical field, can provide several good explanations. But bottom line, don't take it. Sleep is important. The phrase, I'll sleep when I'm dead, simply means you're going to die earlier.
Well said. Dr. Brooks, anything to add or do?
Well, in terms of the question about grogginess when you wake up, everybody has a little bit of that. It's what we call sleep inertia, and it's a function of your sleep debt, whether you're sleep deprived. It's a function of what stage you're in when the clock goes off. It's a function of your circadian rhythm. Most people, I think I can say this, most people in the tech field are night owls. And this is a forward-thinking company. You probably have flexible work times here, but most of the world does not. So most night owls are forced to live on somebody else's schedule, and it makes it very tough to do that without some help, either bright light or caffeine or what have you. But just as an aside, that's also the reason that you've heard the advice, if you take a nap in the afternoon, keep it short, keep it 20 minutes or so. if you sleep much longer than that, you're going to enter the slow wave sleep, and that's why a lot of us will feel more sleepy if we take a longer nap. It's just harder to recover from that.
So these the sleep pods that I know that they have here at Google should be limited maybe to something less than 30 minutes?
Yeah, ideally. By the way, I'm very impressed that you guys have those. I saw one. I didn't get to climb inside of it, but I think that's an enlightened thing to have in the workplace.
One point I just wanted to make also is that I know that it's, in this world, it's very common for all of you to sort of be up late at night, but that's actually not what your body wants to do. So, while you can artificially try to manipulate melatonin levels, it's actually much better for you if you have the option to try to keep with the, the rise of the sun and the set of the rise of the sun and the rise of the moon. So that's always a bit better, and it has some impacts on your health long term too. They've looked at some studies, sort of looking at night owls versus larks who are morning, early morning risers. And, and I think, again, just staying with the rhythm of the sun and the moon is a good idea if you can.
Thank you. So let's take another question from the audience, and then we got one from the Dory. Let's get from all the way in the corner there. So let me repeat the question for our audience. The question was about the New York Times article about second sleep and whether there's something to having different kind of buckets for sleep or to sleep at different times. Dr. Brooks, maybe you can start us off.
Well, I don't know what we were meant to do. I think the important question is what can we do? And I think the polysleep question, getting away from just a monophasic major sleep period, is complicated and very interesting, both just from anthropological interest and also from practical interest. Can we find a better sleep distribution that is more efficient and allows us more wakefulness to be productive or have fun or do good in the world? That would be a good thing. A lot of people have looked for that, and I don't think anybody's found it yet. I'm an advocate of biphasic sleep, meaning a major sleep period and maybe a brief nap with the circadian dip of alertness that occurs in everybody in the mid-afternoon. But of the people that have looked into this, Thomas Edison was probably the poster child for this. He hated sleep. He thought it was a waste of time. But a lot of people have tried breaking the 24-hour cycle into discrete episodes of sleep, multiple episodes, maybe hour and a half every 6 hours. It's hard to do that. It's hard to maintain that. And from what I can tell, the people that have been able to maintain it for any length of time have done so at the expense of sleep deprivation. So having said that, it's okay to experiment for yourself and see if you can find a better pattern, but it's going to be hard to do. The main reason is you can make yourself stay up later in a variety of ways, but it's hard to make your brain turn off. It's hard to make your brain go to sleep if you're battling the circadian alertness mechanism that comes from the brain. Interesting stuff, yeah.
Any of the other doctors have anything on polyphasic? Okay. So let's go to a quick question from the Dory. Which types of mattresses do you recommend and which ones should be avoided? Any thoughts on that?
Avoid the bed of nails.
I guess I'll start since it's sort of a lifestyle question. Clearly, I tend to say a little firm, but not too firm, because you don't want to be in pain while you're sleeping. The other aspect is, does it make sense to have an eco-friendly and sort of a more green mattress? And from my perspective, I think it does make a difference, because ideally, if you're spending a third of your life sort of in very close contact with your mattress, it'd be nice if it wasn't sort of, off-gassing all kinds of chemicals. So if you have that option, and I think they sort of make these, there's a lot more options out here these days, and especially out here. So, yeah.
Anybody else have thoughts on mattresses and that sort of thing? Okay, so let's take another question from the audience. Yes, you over here, please. So the question was managing sleep debt, if I can sort of summarize it that way, or knowing when to sleep more or less depending on different factors.
Well, I could talk forever, but I don't want to take the stage away. So, in my experience, I think it's better to aim to sort of regulate your rising time, and then your sleep time will come more often. Because if you're not modifying, or if you're trying to modify your wake time, then you're going to run into problems like grogginess, and then your whole day will actually get thrown off. But people actually seem to do better, even with sleep deprivation, if they're sort of maintaining a regular morning rising time. I don't know if anybody has anything to add.
Dr. Brooks?
Yeah, I totally agree with that. You can manage your arising time a lot. You're in more control of that than you are your turn off, go to sleep time. I think in answer to your question, I'm glad that you're aware of the concept of sleep debt and the need to do something about it. Just in general, it's better to try to make it up in small increments rather than all at once. But some is better than nothing. So it's almost impossible to ask people who are sleep deprived all week to not sleep in on the weekend when they have a chance. But just try to keep it. Don't go 6 extra hours on Saturday and Sunday, maybe an hour or so.
And I guess one caveat to that is that it's really difficult to make up sleep in that sort of way. So it's kind of better to look at your life. And I know it's hard because, it's a lot of it's sort of project-based here, but to look at life as a marathon. And so you kind of just want to pace yourself. And, and I think sleep is a good place to begin for that.
Thank you. So I know we have a question over there. I'm going to get to it real quick. Let's take a question from the Dory that kind of follows up on this. So it says, the Googler asks, I know we are all different and our bodies have different requirements, but why is it that some people can perform so well with 4 to 6 hours of sleep while others are train wrecks? What can those in the latter profile do to boost cognitive activity? Dr. Waikar, maybe you can talk to cognitive function and sleep.
Okay, well, this is a real can of worms. I mean, I don't really almost want to go on record of saying that there's any one way to solve this problem. I mean, there are so many different, even temperaments. Look at children. From the very beginning, we show different abilities to handle stress and fatigue. And all of us in our jobs, I mean, I remember in medical school, different people could thrive on 36-hour shifts, and others would be just zombies. Now, there's some interesting, if you're looking for answers, it has to be speculation, but I can give you a little bit just to get you thinking about it. There's a notion that the longer you go without sleep, there's a buildup of literally chemicals in your body that have been appropriately termed somnogens. And one theory is that sleep debt is simply a reflection of the level of somnogens that you're carrying around with you. And everybody's sleep, everyone's sleep is different with respect. I'm just going to yell, for this is ridiculous. Tell me if you can hear me. It's not entirely clear how much efficiency people from person to person there is in clearing those somnogens. So, for example, if I'm clearing them at a very high rate, I can feel more restored than someone else who's clearing them at a low rate. Now, this is, again, a highly conceptualized explanation, but the bottom line is there are biological individual differences that explain why some people can handle sleep deprivation more than others. There's also a very pathological explanation as well, and that's something called bipolar disorder. And there's milder forms of bipolar disorder where people in the hypomanic stage, which is a high energy, unhealthy but very productive stage, their hypomania can go on for days, weeks, and during that time they appear to be at the top of their game, but there's usually a heavy price to pay in terms of a crash later on. Now, some have argued that the valley here actually selects for people that have that tendency, And it can get very colorful because the other aspects of bipolar disorder and hypomania in general are very flamboyant, very dangerous. There's a lot of promiscuity, spending lots of money, and doing risky behavior. But the work side can temporarily appear to be very, very intense and productive.
Thank you. Any other doctors have thoughts on that?
What was the original question? Why do some people tolerate deprivation better, or why do some people need less sleep?
Why do some people function better on less sleep, and can anything be done to optimize their cognition? And notice I did not say take a 5-hour energy drink. Do not do that.
Well, first of all, there's a wide variation in sleep need. There are short sleepers and long sleepers. Now, you're talking 2 standard deviations from the norm on either side of the bell curve, but these folks are genetically programmed to be able to get by on 4 hours or require 10 hours. And as far as we can tell, nothing else is wrong with them. It's just a biological phenomenon. In terms of tolerating sleep deficit, we all have our various coping mechanisms. There probably is a biological basis for tolerance, just like there is with pain tolerance. But the other part of that is that people that appear to be compensating for it well may not actually be doing so. Some of the aspects of our life that are affected by sleep deprivation are subtle and difficult to measure. So none of us tolerate it very well.
One thing I wanted to add is that, life is such a rat race when you're awake. Don't make it a rat race when you're asleep. So, I know it's really difficult, but try not to compare with other people because it's, there is such variation. So.
Thank you. Let's get a question real quick. The lady in the back there, yes. Okay, great question. So it was about how to sort of stop your mind from racing when you're trying to get to bed, and also any thoughts on hypnotics, sleep medications. That actually takes care of the next question on the Dory too. Which is, can each panelist give their number 1 tip for falling asleep more easily? So maybe we can just kind of go down the line here.
I'll try to answer the question, which wouldn't necessarily apply to everybody, because that's a very specific thing, which is having a lot on your mind when you're trying to fall asleep can be a wide variety of categories, or let's say levels of severity. If it's literally at the level where your thoughts are racing randomly and you can't control them and it's like a runaway train, then obviously you need to see me separately. But if it's regular stuff like what's been happening over the day or what you have to do the next morning, or basic, we won't call it ruminations, but we'll call it just general noise. There are things related to sleep hygiene, which is the process of coming down at the end of the day, that can definitely help with that. And I'll hold off on that for Dr. Kim, but back to the question of should I just take a sleeping pill? I prescribe lots and lots of sleeping pills. However, for me, I'd like to say that a sleeping pill is almost the last resort. Right? I look at a sleeping pill as if I'm working on a problem with you and it's going to take some time. At the moment, if we must get sleep at all costs, yes, I will prescribe a sleeping pill, but there's a lot of downside to using sleeping pills, especially if you haven't learned about good sleep hygiene, right? Because then you can become dependent on the pills. Once someone is dependent on a sleeping pill, the last thing they want to do is the boring and tedious work of sleep hygiene. So I really make a point to educate people, almost like saying the sleeping pill is a set of training wheels, but we're going to teach you how to ride the bike.
And this is a perfect setup just to become addicted, just because this is more of a lifestyle issue. So, and a person, just a personal, I guess your personal approach to life, because what you're using the sleeping pill for in this situation is trying to override your mind noise. So I think rather than trying to override the mind noise, it's better to think about reprogramming the way that you think about about all of these issues and the way you approach it. So sometimes a sleep journal can be helpful, like about an hour before you go to sleep, and you just write down everything. It's sort of like your place to purge the day. And if you have, some people call it a worry journal, but you just write down everything that's on your mind that could possibly be, bothering you. And then you kind of write down what you're going to do about it the next day, or if there's anything, or if there's nothing to be done about it, in which case you kind of just have to cross it off. But I think it's sort of better to get into this kind of habit rather than into the kind of habit of relying on a sleeping pill that may be changing your sleep architecture and affecting your deep sleep and, affecting you on a longer term basis.
My practice does not really involve much about does not, but the type of doctors I use connect them to my treatment to help that. And I think one of the things, if you listen, there's always the 5-minute snippet on how you can improve something like this. The reality is it's not always that simple. And all of you obviously have access to information for simple answers to this. But again, I think it comes home to the roost that in today's world, if that's not satisfactory and if you can't cleanse the things before you go to sleep and it's leading to poor sleep, there are individuals out there that can now help working with you, just like you would go see a physical therapist, just like you would see in many other aspects. And sort of this dogma that's been attached to sleep is really no longer true.
Dr. Brooks, any?
Yeah, I think just practically give yourself a transition period when you back off of your activating activities at the end of the evening before you lay down and turn out the light. Don't go from playing War of the Witchcraft World Doom 5 and then turn out the light and expect to go to sleep. The other point I'll make about sleeping pills, and I'm not trying to push drugs here, but they're tools like any other new piece of technology, and they're useful in a lot of situations for a lot of people, but you have to use them skillfully. The current generation represents a dramatic improvement over what we used to have in terms of less habituation, longer long-term efficacy, shorter action in the bloodstream in the brain. So I won't say don't ever use them, but use them wisely, ideally for a shorter term than a chronic part of your lifestyle. I know, Dr. Kim, you're going to yell at me. Go ahead.
I don't yell. I was just going to ask you to maybe clarify what judicious use of sleeping pills might be.
I think they're useful for jet lag in particular. If there's something in your life that has created an upheaval that's making sleep less attainable in the short term, I think they're useful for helping you turn off the brain.
So nightly, or for a period of 2 weeks. I'm just kind of
I don't have a magic number.
Okay.
There's studies that show continued efficacy, which wasn't true of the old ones. The old ones, people would develop tolerance and lack of efficacy within 30 days. There's good science now to show that efficacy can last up to a year in some of these. And again, it's I don't want to get into moral issues about taking chemicals. But there are people that take them every night, and you have to weigh, it's a cost-benefit decision. There are people that do better with that paradigm than walking around sleep-deprived all the time.
It's a great point. So let's get a quick comment from Dr. Waikar here.
Sorry, I just want to make sure if any of my patients end up watching this on YouTube, I want to be very clear. There are people for whom chronic illnesses that chronically affect their sleep have benefited tremendously from chronic use of sleeping pills. But if we're talking about someone who does not have a chronic illness, that's the asterisk I would like to put on the conversation that just happened when we talk about 2 weeks, 4 days, periodically. So just want to be clear on that sometimes, unfortunately, we don't have a cure for an illness, and if the illness includes severe sleep disturbance as a side effect, we have to do what we can to help the patient.
Dr. Kim, and then, yeah, please, and then we can move maybe to the next.
I guess, for me, in my practice, I think having someone on a sleeping pill like nightly for a year is a bit long if, in the absence of some kind of chronic disorder, just because in my understanding and my, my education and experience, the sleeping pills don't always induce normal sleep patterns and sleep architecture. And sometimes the way they make people feel better is that they induce sort of an amnesia, so you forget that you didn't sleep well the next morning, which might be better for a lot of people. I don't know if you want to speak to that.
Well, I'm not advocating that anyone in particular go on these pills for a year. What I'm saying is there are people that can do well taking them that way, and if there are other ways to deal with the problem without taking them, sure. But those don't always work. We see a lot of hardcore insomniacs in the clinic, and the sleep hygiene stuff just doesn't work. It just doesn't. They've tried it, and it's not enough.
Very good point. And Dr. Brooks, you'd mentioned jet lag. I just wanted to mention real quick, my company SWAN, we're going to have a jet lag app coming out pretty soon, just FYI. I'm actually curious, are there any questions on snoring? I'm surprised that hasn't come up yet. Anybody have a question on that? Yes.
I wanted to ask something related.
Yes, please.
In some cases, people with insomnia actually have an underlying breathing disorder, which may not be strong enough to numerically cause sleep apnea, but it's fragmented. I don't think in this case necessarily.
So let me repeat the question. So the question was about potential underlying sleep disorders, maybe airway disorders with people that appear to have insomnia. Dr. Hester, maybe you could start us out with sort of some information.
Absolutely. So I think the difficulty here is that you're exactly right. Airway mimic many other sleep disorders. And cause disruption. And your question about it doesn't actually qualify for sleep apnea, I think that also is a difficult area in our field because many times there are very defined criteria used for that diagnosis, but there can be milder aspects of that. And it really leads to being evaluated by somebody who has a comprehensive understanding of sleep disorders and particularly airway sleep disorders. So you're exactly right. This may manifest itself in insomnia, in fatigue, and again, getting back to the fact that this may all be multifactorial, whether it's a psychiatric underlying or whatever, but airway has to be one of those issues. And improvement of those issues, even though I'm a surgeon, I can tell you that anybody I see with an airway issue, I recommend CPAP to. And kind of like what we're talking about with sleeping pills, it is because it is probably the most conservative aspect to way to treat that patient. But the compliance with CPAP, it depends on whose data you choose to believe, is not 100%. And there are all sorts of other alternatives to be used for airway obstruction leading to sleep disorder breathing. That can be anywhere from appliances to procedural therapies. And procedural therapies do work, but we use them as, in most cases, as a last resort to be able to solve that problem. But to answer your question, absolutely can be a component of this. Treatments can range anywhere from CPAP up to procedural, but if it's airway obstruction, then that obstruction has to be alleviated some way in order for you to get into the cycle of sleep and get good sleep.
And I've seen it even in my practice that rhinitis from allergies or whatnot, or just a chronic congestion can contribute to sleep problems. And sometimes just, prescription or nasal rinse can be helpful as well.
Yeah, it again, starting from sort of the beginning, moving on up. The problem is that even those of us who've been doing this for a while, there's no one person in the world that can look at someone's airway who has this sort of issue and know exactly where they're obstructing and how much they're obstructing. That doesn't mean it's a random guess. We're pretty good at it. We're just not perfect. And so you therefore can approach it many ways. But one of the problems is there are many dogmatic statements made about this in a field that probably does not qualify for a field where dogmatic statements can be made. And so you really want to approach this in involving the patient, of outlining the possibilities of what can be done, perhaps starting most conservative and moving up the road to more aggressive treatments if mandated by the severity of their disease.
Thank you, Dr. Hester. So obviously there's lots more questions, and unfortunately we're getting a little bit low on time, but I believe the doctors are going to be able to hang out with us a little bit afterwards so we can maybe chat with them a little bit more. In the meantime, though, it is my pleasure to introduce Congressman Michael Honda, who's going to give our closing remarks today. Congressman Honda.
Thank you, Sina, and thank you very much for the panelists. I think it's enlightening. There's a couple of things I just wanted to be able to emphasize. One is awareness, self-awareness. The reason I say that is about 12 years ago, I was listening to radio. Remember Dr. Dean Adele? He was talking about snoring, and then he related that to sleep apnea, and then he talked about obstructive sleep apnea, and then he described it. And I said, that's me. But I denied it, and I didn't pay attention to it. Then I started noticing, really, that I started to sleep behind the wheel. How many of you know anybody that sleeps behind the wheel? Raise your hands. We all do. How many of you have a sleep partner that snores? Yeah. And those kinds of things are really irritating and really affects personal relationships. So I think once you have a personal awareness, you should do something about it. It's like any other disease that hampers your health and your lifestyle. I'm a policymaker and I was a school teacher, and I started to understand that if I don't learn for myself and do something about it, then I cannot be a good student or a good teacher. I went to Stanford's sleep disorder center and saw Dr. Dement, and they put me in a little room, put electrodes all over my head and my body, a whole bunch of them. And I thought, I'm not going to sleep with all this stuff on. In 5 minutes, I was gone. And they kept talking to me I could hear them saying, keep counting. I said, I am counting. No, you're asleep. It was supposed to be an 8-hour test. 4 hours, they had enough information on me to convince any insurance company to cover me and to pay for any kind of equipment that needed to be adjusted for my own needs. Well, I found out that the next 4 hours they put a CPAP on me, a continuous pressure positive air passage. In 4 hours, the next 4 hours, I woke up. My mind was clear. I was sharp. Just the 4 hours, and my staff hated it. Okay, here's the point. If you think about learning and being alert and being innovative, especially in your field, or you have children that needs to be alert at school, then we have to pay attention to the kind of sleep that they get and pay attention to the kind of sleep habits they have. One of the things I learned about 3 or 4 years ago, more than that, 10 years ago, my daughter graduated from high school. That summer, her friends drove to the different colleges. 3 of them died on the road. Not to drugs, not alcohol, sleep deprivation. They fell asleep behind the wheel. She was devastated. But the families who lost their children could not understand how this could happen. So I think those of us who are watching young people, especially seniors, or if you know anybody, change policies. Policies need to be in place so that we start to pay attention to how our lives affect young people. And I think that personal awareness is going to be a very great, critical kind of thing that we need to learn. And then we pass it on. I snored and I stopped breathing. And my wife used to go and watch me. And then sometimes she would shake me, so I go, right? You've seen that. That's obstructive sleep apnea. My dad had it too. He had an operation. The operation went well. But at his age, other organs started to not function well, and he died. So there's a long-term and a short-term impact on doing something that could be cured, or at least addressed overnight. And I just wanted to let you know that if you know of somebody or know yourself, take action. CHP is one of the things I'm looking at, is hopefully that when they run across an accident that's occurred without drugs or alcohol, they need to report it and take down the information of how that happened. because we think there's over 100,000 fatalities in this country, but there might be more because we don't take all the reports. So more information, better policy, a healthier life. So I just want to thank you all for this opportunity.
I just want to thank Google again for having us host the Sleep-posium here. And like I said, we'll be hanging out with the doctors a little bit afterwards. So thanks again, everybody, for coming in. Let's get a round of applause for the doctors also.